Sethi.
Yes, so good afternoon. I think we got it to work now. So I'm going to be talking about how to use a DICOM viewers to understand the triplanar anatomy in three different planes: coronal plane, axial plane, and the sagittal plane. And this is about the neurocranium. Now so the neurocranium actually consists of four paired bones and four unpaired bones. The unpaired bones are the frontal, the ethmoid, the sphenoid, and the occipital, and the paired bones are temporal bones and the parietal bones, and that's what we're going to talk about today. So I usually use the DICOM viewers. So what you do is you see this is the source data, 411 slides here, and we'll download it onto the DICOM viewer and start the MPR, which is the multiplanar or triplanar anatomy. And this window will pop up, and then you maximize it, and then you go on. Okay, so we start with the frontal bone. As you know, frontal bone has a vertical part and the orbital plate. All right, we're looking at the vertical plate here, and it's in the vertical plate that the frontal sinus is mainly, and then you can sometimes pneumatize onto the orbital plate as well. The most prominent part of the frontal is the glabella, which you see here, and just below that will be the nasion, which is the depression just below the glabella, and that is the frontomaxillary suture. You can see here, you can correlate it with the frontal bone here. Now, if you go laterally, you'll see the supraorbital nerve. Supraorbital nerve is the branch of the frontal, and which itself is the branch of the ophthalmic. It divides into two. This is the frontal nerve, and this is the lacrimal nerve, and there's the trochlear nerve. All these three are the extracornal nerves, extracornal. If you go laterally, you'll see the frontozygomatic suture right here, and just above that, this narrow portion here, the depression here is the temporal fossa, which is the most anterior part of the temporal fossa. It's also called the hairless temporal fossa, where there's no hair, right here in the temple here. Go on to the orbital plate. You see there are two surfaces, the intracranial surface and the orbital surface. As you can see, the orbital surface is smoother and is convex, and this is the intracranial surface is sort of convoluted, and that's because the impression created by the sulci and gyri inside there. Going laterally, this is a supraorbital cell, which is pneumatization of the cells into the orbital plate. You can see it in all three different planes, the intracranial part of the frontal bone, this is the frontal crest. You don't see it very well here, but this is the frontal crest here, and that is where the false cerebri is attached, into which is the sagittal sinus, which runs from the crista galli back to the confluence of sinuses in the occipital bone right here. So you can relate every single anatomy, whether relevant or not, but this is an excellent way to understand anatomy right there. Now, just below the, just anterior to the crista galli here, you'll see a small foramen, that is the foramen cecum, this is actually the a dural sac, which actually is the embryonic remnant of a dural sac, which extends from the anterior cranial fossa up to the onto the dorsum of the nose. And in most cases, it's fibrosis off, but sometimes it can remain patent, and that's why it can cause pathologies like a epidermoid cyst, or sometimes even a meningomycocele. A meningocele. Then just interior to that, on lateral to that, you see the frontal beak, and I think Satish spoke about the frontal beak this morning. That's the left frontal beak, and that's the frontal recess, the frontal drainage pathway. I think Satish has spoken a lot about it, and that's the frontal recess on the right side. Now, the next bone that we want to talk about, the ethmoid bone, it consists of four parts. That is the horizontal, which is the cribriform plate, and the vertical, which is the perpendicular plate, and there are two lateral masses, which are called the labyrinth. This is the cribriform plate right here, and it fits into a small ethmoid notch, we call it. It feels like a lock and key between the two orbital plates of the frontal bone. And you can see here, this is the cribriform plate, and you can see it's perforated by the several foramina, roughly about 20 of them, through which the olfactory nerve pass and form the olfactory bulb. And you can see this foramina on the sagittal section here. And this is the olfactory fossa right here, and this is the lateral lamella of the cribriform plate, this is the medial lamella of the cribriform plate, and this is the olfactory fossa, and this is the olfactory recess. Going here, this is the crista galli, which is also called the rooster's crest, and it's a triangular piece of bone where the false cerebri is attached and continues above as the superior sagittal sinus. The relationship between the crista galli and the frontal bone, that there is a foramen cecum between them. Okay, this is the olfactory fossa, we spoke about it a little bit, and this is the fovea ethmoidalis. The fovea ethmoidalis has nothing to do with the ethmoid bone, except that it is actually on the orbital part of the frontal bone. It's an impression created by a cell onto the frontal bone, and it's the first fovea ethmoidalis that is just just above the anterior ethmoidal artery, and see the anterior ethmoidal artery right here. And the anterior ethmoidal artery, as you know, is one of the 10 branches of the ophthalmic artery. This is the perpendicular plate of the ethmoids, you can see here on the skeleton here, and there is a process, anterior process of the frontal of the ethmoid plate, which comes anteriorly below the nasal bone, and you can see this is the perpendicular plate and the frontal process right here. The perpendicular plate or the vertical plate of the ethmoid articulates with the septal cartilage anteriorly and inferiorly with the molar bone, and posteriorly it reaches as far back as the sphenoid sinus. The ethmoid labyrinth basically comprises of ethmoid cells, and they are divided into two groups, anterior and the posterior group, which are separated by the ground lamella of the middle turbinate. The lateral wall of the ethmoid labyrinth is formed by the lamina papricia, and the medial wall is formed by the middle turbinate, and the basal lamella separates the anterior group from the posterior group of the paranasal sinuses. The middle turbinate has three parts. The anterior part inserts onto the skull base, whereas the middle part onto the lamina papricia, forming the basal lamella, and the third part is almost horizontal, which is attached to the lateral wall of the nose. The anterior ethmoidal artery, we spoke about it, and this is the posterior ethmoidal artery. It's not as obvious as the anterior ethmoidal artery because it runs in the skull base, and the location of the posterior ethmoidal artery is roughly about 4 to 5 millimeters anterior to the optic nerve. Basal lamella is not always readily identified on the lamina on the CT scan, but sometimes you can tell this is basically the basal lamella, and you can see it in all three different planes. So these are the anterior group of the sinuses, and that's the posterior group of the paranasal sinuses. The superior turbinate, how do you know you are the superior turbinate? Well, if you see the free border of the superior turbinate right here, this is the basal lamella, and this is the superior turbinate. Once you see the superior turbinate, you know that you are in the posterior ethmoidal cell. It's a very important landmark to identify the sphenoethmoid recess, because once you see the superior turbinate, then if you go medial to it, you'll be in the sphenoethmoid recess, and then you can identify the superior sphenoid ostium, and proceed on with your sphenoidotomy, as explained by Satish in the earlier case today. Now, going on to the sphenoid bone has 4 parts: the body of the sphenoid, the lesser wing of the sphenoid, the greater wing, and the pterygoid plates. That is the anterior view, and this is the lateral view of the sphenoid bone. This is the body of the sphenoid sinus, which is basically contains the sphenoid sinus itself. The sphenoid sinus has 4 walls, superior and inferior, anterior and posterior, and 2 lateral walls. So 6 basically walls. So on the anterior wall, you can see the and the pterygoid plates are the 4th part of the sphenoid sinus. So this is the sphenoid sinus itself. On the pneumatization of the sphenoid sinus can vary a lot. There can be a very large lateral recess. In this case, we don't see a lateral recess. It's not very well pneumatized. But actually, it's well pneumatized here. You can see there's a lateral recess here. So this is the sphenoid ostium, which lies in the sphenoethmoid recess. You can see very nicely on the on the sagittal section here, and you can see it's very close to the skull base, barely about 2 to 3 millimeters, and that's what Satish was trying to explain, that you should be very cautious not to go too high up there, because if the trajectory is just off by 10 degrees or so, you can actually injure the skull base. And you can see it in both the sagittal section here and also on the axial view here. Planum sphenoidale is the roof of the sphenoid sinus, and it extends laterally as the lesser wing of the sphenoid. I will talk about that. Now, a small part of the planum sphenoidale actually extends anteriorly. See that? To articulate with the cribriform plate here, and that is called the ethmoidal spine. You can see this is the ethmoidal spine, and you can see this is the lesser wing of the sphenoid. So the lesser wing, like I explained, is the extension of the planum sphenoidale laterally, and it is has anterior border which is jagged and articulates with the frontal bone, orbital plate of the frontal, and the posterior border is free, and it basically is related to the temporal bone, the temporal lobe of the brain. So the most obvious part of the lesser wing of the sphenoid that can be identified is the anterior clinoid process that you see here. And anterior clinoid process is a very important landmark because a lot of structures are related to the anterior clinoid process, particularly the carotid artery, and it's the anterior clinoid process sends a small bony strut to the body of the sphenoid, and that separates the superior orbital fissure from the optic foramen. And you see the optic foramen right here, and through the optic foramen is the optic nerve, and the ophthalmic artery pass through the optic foramen right here. So going on, this is the optic canal that you can see right here. This is the anterior clinoid process, and that's the optic nerve canal. The planum sphenoidale ends posteriorly into the chiasmatic groove, and above the chiasmatic groove, you don't see this structure very well, but it's the superior limbus, which that's why I've shown it is shown here, and the inferior limbus and the chiasmatic groove lies between the two. And below the chiasmatic groove is the tuberculum sella. Again, this structure is not well seen on the CT scan, but you can see it in the sphenoid bone here. And below that is the sella turcica and the pituitary fossa. The posterior wall is formed by the dorsum sella, as you can see here, and the posterior clinoid processes. So going down to the surfaces of the sphenoid sinus, there is a superior surface, the lateral surface, and there is a orbital surface. So this is a superior surface, lateral surface, and this structure is the infratemporal crest right here. So three surfaces: superior surface, lateral surface, and this is the orbital surface. And you can see the orbital. This is the orbital bone. The orbital surface of the sphenoid sinus contributes to the lateral wall of the orbit posteriorly, along with the zygoma. It forms the lateral wall of the orbit. Now, this is the inferior orbital fissure right here, and the infraorbital nerve passes through the inferior orbital fissure. Let me see if I'm not sure if this video will work. Okay, you see this, follow the infraorbital fissure, and this can see the nerve coming anteriorly, and this is it ends here. Then it runs into the pterygopalatine fossa and into the foramen rotundum. So this is the infraorbital crest, and lateral to the infraorbital crest is the temporal fossa, and medial to the infratemporal crest is the infratemporal fossa. The temporal fossa is run from anteriorly from here right back here. It's a very large fossa. You can see here, and the floor of the temporal fossa, this is basically a union of four bones here: the frontal bone, the parietal bone, the greater ring of the sphenoid, and the temporal bone. And this union here is called the pterion, where the four bones meet here. And And the content of the temporal fossa is the temporalis muscle, which arises from the inferior temporal line. The superior temporal line forms the attachment of temporalis fascia, and it inserts onto the coronoid process, which is right here. Now, the infratemporal crest, the medial medial to the infratemporal crest is the infratemporal fossa. And these are and in the infratemporal fossa, the roof is formed by the greater wing of the sphenoid. We'll talk about that a little later. And the medial wall is formed by the pterygoid plate and the pharyngeal wall. And laterally is it communicates with the infratemporal fossa through the pterygomaxillary fissure. This is the pterygomaxillary fissure, and right here, you can see it on the CT scan here in all the three different planes. Now, and it leads on into the pterygopalatine fossa right here. This is the pterygopalatine fossa, and as we know, pterygopalatine fossa is a very important conduit for a lot of structures that pass from the anterior nasal cavity and towards the sphenoid sinus and even to the middle cranial fossa. So here is the infraorbital fissure. Now, the strut of bone from the greater ring of the sphenoid will pass on to the body of the sphenoid sinus, and that is called the maxillary strut, and that forms the foramen rotundum through which the infraorbital nerve, the V2 will pass. You can see it in all the three different planes right here. That is this is the foramen. That's the maxillary strut, and this is the foramen rotundum, and you can see this is the inferior orbital canalicus, and here is the pterygopalatine fossa, and the nerve is running through the foramen rotundum right here. And you can see here again, you can see this is the foramen, this is the maxillary strut being formed right there. Okay, the maxillary strut actually separates the orbital V2 from the superior orbital fissure, and this is the structures that run in the superior orbital fissure are of the extraauricular muscles, and this is the superior part of the oculomotor nerve, inferior part of the oculomotor nerve, and the nasociliary nerve, and that's the sixth nerve. These are, and of course this is the optic nerve, ophthalmic artery, superior vein, ophthalmic vein, and the inferior ophthalmic vein. These are the contents of the sclera. Laterally, as medially, the pterygopalatine fossa communicates with the nasal cavity through the sphenopalatine foramen. You can see here, and the greater palatine foramen, they're right here. And these are the greater palatine nerve and the lesser palatine nerve passing down to the palate. This is the median nerve, which is a very important landmark to identify the paraclival chloride artery, and lateral to that, or medial to that, is the platovaginal canal. The median nerve, again, you can see it right here. You can see that coming around to the foramen lacerum right here, and you can actually see it in all three different planes. And that's the platovaginal canal, which is supplies the nasopharynx. On the lateral wall of the sphenoid sinus is the cavernous sinus, and this paraclival internal carotid artery right here. That's the foramen lacerum, and that's the carotid artery coming up here, going into the cavernous sinus. So this is the foramen ovale, and the mandibular nerve, or the V3, passes through it along with the other structures like a mystery vein and sometimes a lesser petrosal nerve. It is a very large foramen. You can see it identified at all three different planes. And the V2 will basically has two branches, the anterior branch and the posterior branch. The anterior branch basically is all supplies the motor, whereas the only sensory branch of the anterior branch is the buccal nerve. And the posterior branch is mainly all sensory branches, and there are three branches right there. This is the oculomotor, auriculotemporal nerve, and that is the lingual. The most medial is lingual, and the most lateral is the auriculotemporal, and this is the inferior alveolar nerve that comes in, along with this is the IMAX that is in the infratemporal fossa. Now, as you go, this is the inferior alveolar canal, and the inferior, this is inferior alveolar nerve passes through it, and before it enters the inferior alveolar canal, it will give up the nerve to the mylohyoid, which supplies the anterior belly of the digastric and the mylohyoid muscle. This is the foramen spinosum. Lateral to that, you see it in the same plane as the inferior alveolar nerve, and the middle meningeal artery passes through the foramen spinosum. Lateral to that is the spheno-squamous suture, and this is the junction with the squamous part of the temporal bone. The pterygoid plates, there are two, the lateral pterygoid plate and the medial pterygoid plate, and the muscles that arise from the lateral pterygoid plate are the lateral pterygoid, and the medial pterygoid arises from the medial surface of the pterygoid plate. There is the medial pterygoid plate as a hook at the lower bend, that's called the pterygoid femur, but you don't see that very well on here. The posterior wall of the sphenoid sinus is formed by the clivus, at least the upper third and the middle third, and the lower third is contributed by the occipital bone, and in between that there is a synchondrosis, which is called the spheno-occipital synchondrosis, which basically fuses at about the third decade of life. That's the middle third, and this is the lower third, which is part of the occipital bone actually. You can see it in all three different planes, and this is a carotid canal. The internal carotid artery enters through here, passes through the Petrus wall of the Petrus part of the temporal bone, and enters the sphenoid sinus. And you can see it on the. You can see it here. You can follow it all the way, passing through the Petrus, and becomes a paraclival. This is the foramen lacerum. So this is the retroclival fissure that you see here. Again, in all three different planes. And now going on to the temporal bone, actually just very quickly, that's the superior semicircular canal. And this is the ampullary end of the superior semicircular canal, non-ampullary end. And this is the ampullary end right here. And then this is the subarcuate canal. I'm sure you're all very familiar with the anatomy. Just very quickly, I'm going to run through it. This is the posterior semicircular canal, and it forms the crus commune with the non-ampullary end of the superior semicircular canal, and it passes around the lateral semicircular canal to open into the vestibule. The ampullary end opens into the vestibule. Here is the, you can see the porous part of the internal acoustic meatus. You can see the vertical crest here. This is the labyrinth part of the facial nerve, and the superior vestibular nerve will run around here. You can see it in the next cut very nicely. This is the labyrinth part and the superior vestibular nerve. This is the internal acoustic meatus. That's the vestibule, and this is the lateral semicircular canal, and that's the crus commune, and that's the posterior semicircular canal. Here you can see the signet ring sign, and which is the lateral semicircular canal. This is the vestibule has formed right here, and this is the posterior semicircular, and you start to see the basal turn of the cochlea. This is you are all very well familiar with that. This is the canal for the facial. This is the horizontal crest, vertical crest, foramen for the facial nerve, and this is for the superior vestibular nerve. Cochlear aperture is right here, and this is for the inferior vestibular nerve, and that is for the cingulate nerve right here. Now this is, you can see it very nicely here, the modulus right here, and you can see the facial nerve crossing right here, and that's the facial nerve, and it has crossed this is stapes, and has crossed over to the mastoid, the second genu. And here you can see the ampulla of the posterior semicircular canal, which is joining the vestibule right here. And you see this shadow here, that is the cingulate nerve, and you can see it very nicely on the negative here. That's the cingulate nerve running from the internal acoustic meatus to the vestibule. You can see it very nicely here, I believe. You can see that. That's the cingulate nerve right there. So this is the basal turn of the cochlea right here again, and that's the round window. The facial nerve. This is the video of the facial nerve showing you all the, that's the GSPN going anteriorly, facial nerve coming posteriorly. Let me run it quickly. Okay. And you can see the entire facial nerve, master segment of the facial nerve on the central section here. So sometimes you can see the cochlear aqueduct. Now, the cochlear aqueduct is very important landmark for identification of the ninth cranial nerve, which I'll discuss tomorrow on the MRI, and it runs from the round window to the upper clump. I don't think it's very well seen here, but you can make out a shadow running here from the round window to the upper clump. See that right here? And opening into the upper clump. All right, so I think we have done that. And this is the jugular tubercular, the 9th, 10th, and 11th nerves runs from the jugular tubercular here, and that's the hypoglossal canal. You can see the hypoglossal canal. Sorry. See that? And this is the occipital condyle, that's the atlas, this is the odontoid process. So here you see a very large jugular fossa right here, much smaller than that's because most of the blood drains into the right side. Very large, a very small jugular fossa here. And you can sometimes trace the condylar canal. Let me see if you can see the condylar canal right here. You can see this. This is the condylar canal that transmits the condylar vein, which is a very large emissary vein. So the most posterior part here is the bastion, which forms the anterior part of the cisterna magna, or the right here. And we don't see the posterior part because the cut, you don't have that here, and that called the opisthion. And I think that's the atlanto-occipital joint. And I think now, this is just 1 minute clip, you can see the entire thing, and you can scroll through the entire anatomy just in about 3 minutes, and you see that on the scan right here. In less than 3 minutes, you can scroll through the entire anatomy, and this is what you should aim to achieve, to be able to look at this very quickly in all this place. You can see that. So you can identify all the structures on this. You just don't look at the sinuses alone, although you're asking, but try to make it a habit to look at all the structures. And this way you consolidate your knowledge of the anatomy, not only radiological anatomy, but even gross anatomy. I find it very useful, and been doing it for a few years now, ever since DICOM viewers became available. And I think it's very important to educate patients as well, to plan your surgery. And so thank you very much for your attention then.
Thank you very much, Dr. Sethi, for such an enlightening talk. We'll definitely look at CT scans more in details before we do every case now. Thank you.
Thank you very much.
May I request Dr. Vimal Kasbekar ma'am to felicitate Dr. Dharambir Sethi sir.